Welcome back to the Bliss Dermatology and Wellness channel. Today we are walking you through something we get asked about all the time. What does the hair restoration process look like from start to finish? What are the steps? What should you expect along the way? And how long does it take to see results? Hair loss is one of those concerns that tends to build slowly and quietly before it becomes something a patient feels ready to address. By the time most people come to us, they have already been watching it happen for a while. So today we want to meet you at the beginning of that journey. The moment you first notice something is off, and walk you through every step of what a thoughtful, comprehensive hair restoration plan looks like at Bliss. Prescription strength minoxidil is often one of the first clinical interventions we introduce, and it is one of the most well-established treatments in hair restoration medicine. Minoxidil works by increasing blood flow to the scalp and prolonging the active growth phase of the hair cycle. It essentially encourages follicles that have been spending less time actively growing to stay in that growth phase longer, which over time leads to thicker, denser hair and a meaningful reduction in shedding. Now, with this product, consistency is the most important factor. Results develop gradually. Most patients notice a reduction in shedding within about 6 to 8 weeks, and then they start to notice a visible improvement emerging around the 3 to 6 month mark. It's a long-term commitment, and we're here to support patients through that process. If minoxidil alone is not enough to improve hair density, we move into the next phase of the restoration plan, a series of in-office PRP and microneedling sessions. These two treatments are highly complementary, and we use together, they produce results that exceed what either achieves independently. So let's walk through how each one works. Microneedling for the scalp uses a device equipped with really tiny sterile needles to create controlled micro injuries across the treatment area. These micro injuries trigger the body's natural healing response, stimulates the production of growth factors, increases blood flow to the scalp, and promotes cellular activity around the hair follicles. That healing response plays an important role in reactivating follicles that have become dormant. This encourages them to transition from the resting phase back into active growth. Platelet-rich plasma therapy takes the regenerative process a step further. During the treatment, a small blood sample is drawn from the patient and processed through a centrifuge to concentrate the platelets, which are the cells that are rich in growth factors and are responsible for tissue repair and regeneration. That concentrated plasma is then injected directly into the areas of the scalp that are experiencing thinning and loss. Once delivered, the growth factors stimulate dormant hair follicles. They help improve the blood supply to the hair, and they work to prolong the active growth phase of the hair cycle. What makes the combination so effective is the synergy between the two procedures. The microchannels created by the microneedling temporarily increase the scalp's permeability, which allows the PRP growth factors to penetrate deeper into the tissue surrounding the follicles than they would through an injection alone. At the same time, the microinjuries prime the tissue to respond more readily to regenerative signals that PRP delivers. The result is a compounding effect for patients experiencing moderate to significant thinning. This combined protocol is our most recommended approach. A standard protocol consists of 3 to 4 sessions spaced approximately 4 to 6 weeks apart. Most patients begin to notice a reduction in shedding within the first 2 to 3 months following the protocol. Visible improvements in density and thickness typically emerge over the course of 6 to 12 months as the hair growth cycle progresses and new growth matures. Results are gradual and cumulative. Completing the initial series of PRP and microneedling sessions is a significant milestone, but it is not the end of the journey. Hair restoration is a long-term process, and maintaining the results you have worked to achieve requires ongoing support. Once a primary protocol is complete, we transition patients to a maintenance schedule that typically involves touch-up PRP and microneedling sessions every 3 to 6 months, depending on how the individual is responding and the degree of loss we are managing. These maintenance sessions reinforce the regenerative environment in the scalp, sustain the improvements in hair density and follicle activity, and help prevent the continued progression of hair loss over time. During the maintenance phase, we also continue to monitor the foundational elements of the plan, which can include supplements, oral or topical minoxidil, and any underlying hormonal or nutritional factors that were identified early on. If anything needs to be adjusted, we make those refinements as part of the ongoing treatment. If you've been noticing changes in your hair and are not sure where to start, we encourage you to come in for a consultation. We will take time to evaluate what is happening, explain what we are seeing, and build a plan that is right for you.